Namaste. I'm sending you warm greetings from Slovenia, from the heart of Europe, and I'm very honored to spend the next 10 minutes with you to discuss on such an important topic as health and well-being are. And I believe that in today's time, in current pandemic, we're all aware how important it is, right? So I'll start with a quote from Global World Health Organization saying that health is our precious global good, and I bet that now we are all aware and that the current situation taught us a lesson why it is so important to maintain our health and to care for it. When we're talking about health and well-being, we are facing many challenges. And the majority, or the biggest challenge, is definitely unhealthy lifestyle. We know that unhealthy lifestyle is strongly related to chronic diseases as cardiovascular diseases, cancers, respiratory diseases, and diabetes. We know that those conditions could be prevented by maintaining healthy lifestyle, and the sad fact is that chronic diseases kill about 41 million people each year, which represents 71% of all global deaths. And imagine, the majority of them could be prevented. Today we are all living or experiencing excessive amounts of stress. We live a sedentary lifestyle with lack of physical activity. Mental health issues are rising, the population is aging, and we have a big issue with overweight and obesity, which is becoming a new smoking. We are aware that during the pandemic, those problems didn't vanish. The current pandemic just added on the additional stress related to COVID-19. So we know that we need to prevent the virus, we need to prevent and stop the virus spreading all around the globe. We need to help to healthcare system not to collapse, and we need to maintain and practice physical distancing. This also includes remote work, working from home, lack of physical touch, visiting healthcare centers, physicians, therapists, and so on, and these are becoming challenges, and this is our new reality. And talking about the problems, we have a vision for healthier tomorrow. We know that 50% of healthcare costs would be gone tomorrow if people didn't smoke, if they would maintain ideal body weight, if they would improve their nutrition, if we would increase physical activity, strengthen flexibility trainings, if we would use alcohol moderately, if we could and would practice some common safety initiatives, including appropriate precautions related to COVID-19. And at the end, of course, if we would develop social interactions, purpose, and fun. And when we talk about health, it's often we can hear it's written in our genes. It is, but the researchers show that 30% of our health goes to genetics, 10% goes to healthcare, and the 40% goes to our own behavior. So that means that 40% of our health is actually in our hands. And what we do, are we taking appropriate actions to maintain the health? And unfortunately, sometimes the preventive is not enough. And the role of rehabilitation is increasing in curative medicine. We know that the need of rehabilitation is predicted to increase, and it is increasing at the moment. We know that all the changes I was mentioning, including longer life expectancy, more chronic diseases and disabilities, are increasing the need of rehabilitation, and the current need is unmet. We also know that in low and middle income countries, more than half of the people do not receive the treatment they require, and the COVID situation even make the situation worse, because the existing rehabilitation services in 60 to 70% of countries have been disturbed due to the pandemic. So another issue, it's not just preventive, but also what happens after when we need a medical intervention. So we are not just emphasizing or stressing out the problem, we are also trying to solve the health and well-being occultation. So at 24alife, together with the Mayo Clinic, we developed different programs, preventive programs, and also rehabilitation programs to help people to maintain healthy lifestyle, to be healthier, to be happier, and of course, to recover faster. And with the support of IT technology, we are able to spread information that programs all around the globe, and even in this current situation, is just on place. So as I mentioned, when now it's the time to understand or to seize the importance or the benefits of modern technology, all the online programs and telehealth. We know that with such a support, we can decrease strain on healthcare system. We can expand access to care and reach more people, patients, employees. We can improve people engagement with remote tracking and with the feedback loop between a physician or expert and the user can provide an important feedback for each of them to stay motivated and to adjust the programs if needed. Of course, by the use of such a programs, we can support the independence of the people, and with integration with plenty of other devices, of course, we can make the experience even more accurate and safe and efficient, of course. And such a programs can be also used not just the process of rehabilitation or in preventive health, but as a part of well-being programs in organizations. Even though that people are now working remotely from home, that doesn't mean that they're not experiencing stress or other issues. And I think that as an employers, we need to be responsible and take care for their health, the employees' health, also during the pandemic, which in my opinion, it's even more crucial than ever. So not just offering solutions, you need to understand and to target the needs of the people, because not everyone has the same issues. So together with the Mayo Clinic, we delivered different programs, evidence-based program with validated and trusted information, targeting different problems, different areas, from coping with stress, becoming more resilient, to nutrition with Mayo Clinic diet and Mayo Clinic diet for diabetes, raising health awareness with 12 habits of highly healthy people, and of course to develop the purpose and happiness in life with different programs. So such a menu of different interventions can help to support people in actions while trying to adopt a healthy lifestyle. But sometimes, of course, people need an individual approach, more specific approach. So in that manner, we also created a platform that helps enables physicians or experts to prescribe a program, to create a program, especially in the field of sport exercises, sport program, rehabilitation program, therapeutical exercises, to create an individualized program, deliver it on the mobile application of the user, and they are guided and they can follow the program. It's just like prescribing an exercise as a medicine. So in that manner, we can, as I mentioned, reach more people and create the experience much more enjoyable. So I won't go too much into details, but there is a return on investment. Many researchers show that even $1 invested in preventive health can return on up to 3, 5, 7. In Europe, we even report about 10 to 11 euros per euro invested in the well-being or preventive health. So actually it's not a cost, it's an investment. And who should benefit, as I mentioned, definitely individuals, but also organizations as a part of wellness program to decrease the levels of absenteeism, presenteeism, and fluctuation, and of course to become an employer of a choice, showcasing that we care for the people and for their well-being. Nonetheless, insurance companies, because healthier we are, more benefits they have, and of course the economy and society from creating more healthier and happier environment to fulfill, the mission of creating a happier and healthier world. So that would be all from my side. I'll say thank you, shukriya. If you have any questions, I'm happy to answer. If not, I'll just say take care, stay safe and healthy.